Good morning, everybody. My name is Oren Levine. I'm Director of Innovation at the International Center for Journalists, and I'm really thrilled to be moderating this webinar about the coverage of the COVID-19 vaccine and the challenges of misinformation and disinformation around that. And we're thrilled to be joined with some really knowledgeable global experts on this. Unfortunately, one of our panelists, Syed Nazakat, founder of Health Analytics Asia, was supposed to join us for this panel, but he unfortunately was called away for personal issues. We're sorry to hear that, but we'll go ahead with our other two panelists. So what I want to do is ask our two panelists to introduce themselves briefly, and then we'll talk about the subject at hand. So Cristina Tardaguila from the International Fact-Checking Network. Tell us a bit about yourself.
Hey, Oren. Hello, everyone. Thanks for being here. It's a great pleasure to be talking to this great audience. It is wonderful to be in this Zoom with my friend Lee and others. Well, first of all, I'm Brazilian, so I have to excuse my great and terrible English. You'll be hearing a lot of mistakes today. So I'm the Associate Director of the International Fact-Checking Network. For those that might not know what the IFCN is, the IFCN is a group of fact-checkers that got together around the Poynter Institute here in the United States to fight for more fact-checking, fight for more room for fact-checkers in the platforms. We advocate for a peaceful and a universe where falsehoods have no room. And well, I'm also the owner of Agência Lupa, which is the main fact-checking platform in Brazil. And well, and here I am to explain a bit what we have done so far this year as the coordinator of the Coronavirus Facts Alliance, which is probably the biggest and toughest to collaborative project in fact-checking. So thanks for having me here, and I hope we can have a wonderful morning.
Great, thanks. And we're also joined by Mwiti, Chief Editor of Africa Czech, currently, as he said, in lockdown in Johannesburg, in South Africa.
Thanks, Oren. So yes, I am Mwiti. I am Chief Editor of Africa Czech, which is Africa's first independent fact-checking organization. We were set up in 2012. We have 4 offices in Kenya, Senegal, South Africa, and Nigeria. What we do is that we are a non-partisan organization that promotes accuracy and honesty in public debate and the media in Africa, because we believe that poor information contributes to poor decision-making. So through these, we seek to strengthen democracy and improve life outcomes. We do this by following the best practices in fact-checking, recognized by leading non-partisan fact-checking organizations around the world, specifically the International Fact-Checking Network, of which Chris is Associate Director. Our principles focus on transparency, including of methodology, organization, and funding. And we also run a number of training programs to promote fact-checking skills among the media, business, civil society, and the public. I might also mention that we look to nurture and collaborate with other fact-checking organizations on the continent to grow a fact-checking sort of movement.
Great, thanks very much. So as I said, the context of our discussion is the World Health Organization has named vaccine hesitancy, or hesitancy of people to get vaccines, one of the top 10 threats to global health. So this is a problem that's been around for a while, many sources, and there was a Wellcome Trust survey back in 2018. They surveyed people's attitudes toward vaccine and science then a couple of years ago, and found that in some regions of the world, like Western Europe, only about 59% of people in general trust vaccines. In Eastern Europe, it's about 50%, whereas other parts of the world, North America, Northern Europe, and parts of Africa and Asia, the percentages of people who trust in vaccines is much higher. But even before the COVID epidemic, there were challenges with public acceptance of vaccines and rates of vaccinations around the world in different communities for lots of different reasons. So COVID-19, unfortunately, is adding to this existing uncertainty and distrust of vaccines because of the speed of vaccine development, and then which may lead to additional distrust of vaccines, even among people who trust vaccines for other diseases. We had unfortunately, a very topical news story relating to this webinar this morning when Russia announced that they had developed a vaccine, which they're calling Sputnik 5, after a very, very rapid process, and they intend to put that on the market, leading to, again, a lot of uncertainty and doubts about whether they had followed all the procedures and all the rules of vaccine development. So, and that's sort of a concrete example of the challenges we have going into vaccine development around COVID. So what I'd like to hear from Chris and Lee is sort of more of a understanding of what are the challenges and problems you see in reporting on vaccine development on COVID, and any sort of guidance and thoughts you have for journalists facing the situation. So I want to first get a sense from both of them what the challenges and problems are, and then we'll do a round of what they think the solutions are and what activities they're doing to counter information and help provide citizens with useful information to make informed decisions. Chris, let's start with you.
Thanks, Oren. So let me share a bit of what we're seeing right now in the Coronavirus Facts Alliance in January. And it gathers now 99 organizations that do fact-checking around the planet. And we cover more than 70 countries and more than 40 languages. And we have debunked about 8,000 hoaxes about COVID. And what we're seeing now is completely related to what is going on today, the vaccine and the need and what is going on around the studies about vaccine, the COVID-19 vaccine. I want to highlight, and it's amazing that we're doing this conversation today and the Russian announcement, and this is completely perfect to discuss this today. We are already seeing so many hoaxes regarding the vaccine for COVID, and I want to highlight at least 5 different very important topics that are bringing misinformation and the vaccine for COVID. The first kind of hoaxes that we're seeing related to this new vaccine, or I don't know if the Russian is the vaccine, the final vaccine, but I want to have people that are hearing us. It doesn't matter if you're just if you're like a common citizen or if you're a journalist, but be aware of hoaxes that are relating the vaccine to abortion. We're seeing many of hoaxes that are relating these 2 things. The second level of hoaxes is relating vaccines and fertility. So we are also seeing that. And these 2 first connections, they're coming, of course, from the anti-vax movement, but also from the religious movements. So they're using these kinds of connections to undermine the need of vaccine or to spread fear against the vaccine, which is kind of interesting from the fact-checking perspective, because we have been fact-checking content about something that does not exist yet. And I will talk further about that in a minute. But I would like first to talk about the third type of hoaxes that is already seen against the vaccine is the anti-foreigner. And we can now see, well, it was clearly anti-China. The vaccine was supposed to come from China, and maybe today it will be a big turn since it's probably going to be anti-Russia. We're going to see hoaxes questioning the quality of the study, the quality of the doctors, the quality of science in those countries. And just look for that, because it doesn't mean that it's either coming from China, Russia, or the United States. It doesn't, I mean, the nationality of the vaccine doesn't mean anything. We really need the vaccine. So it doesn't matter where the science comes from. We really need it to be good, right? And then with the 4th wave of misinformation that we're already seeing in the Coronavirus Alliance related to the vaccine is the anti-tech. You've probably seen and received that, especially if you're on WhatsApp, how the vaccines are bringing chips to trace your path in the planet, right? This is very interesting, and it's usually connected to Bill Gates, which the person I think that has suffered the most in the COVID pandemic. This has no. It's not reliable at all. So be aware of those 4 things. But then I would like to call attention to the fifth kind of misinformation related to COVID. And this really strikes me. And I know I'm coming from Latin America, and I can really see this starting today since Russia announced it. I'm calling this the fake vaccines. And please be aware of people trying to sell fake vaccines. Now that Russia has said that they have something that might work, be aware of, smart people trying to sell cheap vaccines or trying to cure with cheap injections or whatever. We need to be aware of those kinds of e-commerce or traditional commerce promoting false cures. That's the kind of hoaxes that we've been seeing as the biggest wave in the Coronavirus Facts Alliance. And it's really, really hard to explain that, this is the real vaccine once it exists, and this is the fake one. Do not pay half of the price because you will not get cured. So I will leave it this way, Oren, so Lee can talk a bit and we come back.
Well, one quick question to you before we go
Sure.
to Lee, because actually the question came from a participant before the webinar. As you said, there's sort of lots of information and fake information, both from anti-vaccine forces, and possibly, you said there are also possibly false vaccines or incomplete vaccines. So how can ordinary people tell the difference, and how can journalists tell the difference? And maybe one way to frame is, what questions should journalists and people be asking to help figure out what to believe and what not?
It is going to be tough times. It's going to be really, really tough times for us. And well, first, we as fact checkers, the Alliance is here, and we have planned a big structure to help. We have created the Alliance. The Alliance is available now in English, in Spanish, in Hindi, in Portuguese, and it is available in chatbots for WhatsApp. So anyone can access content from the Alliance and all the fact checks that have been done in these 4 languages at least, and for free on WhatsApp. So anytime I can easily share that, the links or the URLs to access that, and please use that. That's the first step, quite easy. But also be aware of official sources. I would say that do not trust your uncle on WhatsApp. Do not trust a tweet that comes from unofficial sources. It's time to heavily use official sources, and please do not trust your neighbor. Do not trust do not trust biased people. Please do not do that.
Thanks. Lee, I'll go to you with your sense of what you're seeing in your work about the challenges.
Thanks, Oren. I think the main challenge we've seen in the 4 countries we work in, because we also monitor the media a lot, is a challenge of under-resourcing. And this, in a way, is obviously a result of the changes we've seen in how people consume news. There's been quite a shift to digital, and we've got all these big tech companies that are eating the lunch that is meant for media houses. So this then means there is a sort of race to be fast to publish information. And that means then you're not taking due care to interrogate certain pieces of content. So you not, for example, you don't have the time to do explanatory journalism. And this would be quite useful, for example, if you are able to tell audiences that this is how a vaccine is developed, and these are the stages that it needs to go through before it is ready for mass consumption, if I may call it that, or mass usage. So in such a space where resources are scarce, then journalists are not going to have the time to further interrogate information that they are seeing. And this also means then newsrooms are strained in terms of they're not able to invest in fact-checking skills, which would be quite useful for journalists. One, I did say it's an issue of time and the rush for eyeballs or for clicks, but also, if you cannot invest in fact-checking, then you're going to struggle in knowing what to publish or what to cast a spotlight on. And this brings me to my third point, that if newsrooms are under-resourced, it means then editorial decisions are going to be also strained or made on the fly. So you don't know, you know, or rather you don't have enough time to decide what you're going to cover as a journalist. You've not thought about, say, the tipping point. Do I need to move this information from where I'm seeing the corners I'm receiving it from into the mainstream of the platform that I am using as a journalist? Or say, what would be the social benefit? Does it add any new pillar to existing public debate around vaccines? Or what is the potential harm? Am I just giving, say, influencers a bigger platform, you know, and I'm giving, say, or rather, it could even lead to harmful situations where you have people who are quite spooked about vaccines attacking vaccinators. It has happened in Nigeria where people who've been on vaccination campaigns have been attacked. So I think the key issue is under-resourcing of newsrooms, and that then cascades down into various outcomes that we see as journalists try to keep up.
Thanks. Actually, a question on that then, both for you, Lee and Chris. Given a situation where journalists are under-resourced, overwhelmed, and have so many stories coming, I wonder if you could suggest, like, what one question or two questions should they ask? You know, if you only have time for one question, for example, on a story, or what would that question be to make sure to sort of separate the wheat from the chaff as easily as possible?
Well, I would go Lee.
Oh, sorry. I think one would be the source. Where am I seeing this? So that then I make a decision as to how much weight to you know, lend it. If it's some fringe group, it's in a group I am in, or it's a group of people with core interest around an issue, then I know whether to weigh whether this is something that is, you know, you know, that is something that is important to only a small group, or it is something that the public should be debating. So I think a way to weigh the source of any information that you want to cover around vaccines.
Mm-hmm. Chris?
I would also, besides that, we totally agree, but I would also add, where else am I seeing this? It's here, but just here, you know, where else do I read it? And are these sources connected to each other, or are they different? You know, am I seeing this on let's say, leftist media and rightist media, or is this just one side? Or, you know, just to be a clear mind.
I wonder, because we had a question too about, actually specifically, for example, about the Russia story, which is really a great example of all this, is the fact that a lot of the information and data behind it seems to be secretive. Where's the role of, you know, questioning that kind of sort of the transparency and completeness of the reporting? Is that something, how do journalists use that, especially even if they're under-resourced?
I can take that, because this is something that has been bothering me a bit lately. Please, if there are any journalists and reporters in the audience right now, please don't stop just being, you know, just typing whatever people say on your interviews. We always have to be critical of what we hear, because if not, we're just probably giving oxygen to mis and disinformation. So if you're reporting today on the Russian vaccine, please make sure that your headline brings the information that their testing is still being done, or the scientific community, the international scientific community is still still like looking at it with some doubts. Make sure that you will not leave this to the very last bottom in the paragraphs. You know, make sure that you you do not highlight facts the way the person that you have interviewed wanted to be. You are a journalist. You have to be critical with what you are hearing, and filter and put that information into test and fact check that. So that would be my advice for today, at least, with regarding the Russian vaccine.
Right. And Lee, so back to what you said earlier, that's actually, it seems like an excellent way to go, what Chris said, but the challenge is then how do you do that if you're a journalist in an under-resourced newspaper facing both deadline pressure and commercial pressure to get a story out?
I think this is where the role of collaboration comes in. If you've built one, say, networks with scientists, people who can quickly explain how the process of making vaccines and releasing them to the public is, then I think it will really help you. But also, I think there are lots of alliances that are at play which can help you in terms of making quick decisions. I think Chris mentioned the Coronavirus Alliance, which is one quite very useful one. But I think I've always said there's room for journalists to collaborate more because again, I mean, we fact checkers do it quite well, but for journalists, probably it's a bit more difficult because you're talking of competitiveness, there's a race for eyeballs. But if journalists were able to collaborate more, then I think it could be seen as a public service that would restore trust in the media and have longer term gains. So we've seen examples of these around elections mainly, but I think the pandemic is another useful space that journalists can build collaborations in different media houses that will look to one, aid in making better decisions, but two, restore trust in media houses, which you might say has taken quite a bit of battering in recent years.
Mm-hmm. So actually, let's keep going with that, Lee. Actually, so let's maybe hear more about the collaborations you're working on and more of what you're doing at Africa Czech and your collaborative partners to help sort of clear the air and provide useful information.
Yeah, we've got two. One is the one that Chris mentioned too, alluded to, the Coronavirus Alliance database, which we contribute all the work we've done in fact-checking claims made around the pandemic, from vaccines to pretty much cures, hoaxes, scams. But also we are quickly building a network of fact-checking organizations that around the continent that will allow us better understand what kind of misinformation is flowing in different parts of the continent, because context is very important. You cannot take the continent as a whole, and it helps to understand what are the underlying issues in each country so that you can know why misinformation is prevalent in any different country. So we've been building quite a network of fact-checking organizations, about 13 or 14 budding organizations and then established ones. So we look to, in a way, leverage on those collaborations so as to better understand how misinformation on the continent is different from what we see in other parts of the world, say the global north. And thirdly, and this is one we're quite excited about, is a collaboration we are working on with the WHO, Africa region, and also with Africa CDC and a number of other fact-checking organizations on the continent. We see it as a pathfinder, so that we think if we can make it work, then we can maybe contribute lessons to the rest of the fact-checking community and to journalists globally in terms of what works and what doesn't work. In a way, it builds on alliances that we've seen in the past, but this has got 4 key pillars that I think would be quite useful. One is obviously surveillance and monitoring. That is something that tends to be quite useful for journalists, because you know, if you can identify misinformation before it goes viral, then I think you've got a good chance of pushing back against it. There is also an amplification, or rather a simplifying pillar, where you obviously fact check, you research, you write up, you decide whether something is right or wrong, and then after that we've got the amplification pillar, and this is quite important because we're looking to, one, build collaborations with a number of media houses, because then we're looking to break misinformation or other fact checks out of established audiences. We get a lot of criticism that fact checking is in a way self-selecting. The audience is self-selecting. People are already interested in accurate information. So we want to be able to break out of that audience to reach people who are more vulnerable and who may not have access to fact checks online, for example, radio, rural communities. So there's the amplification pillar, which would be quite useful for media houses, because also they have ready content and they're able to fact check quickly in terms of if they see anything around vaccines, then they can leverage on the experts ourselves or organizations like the WHO. And the last pillar of this is around knowledge, in terms of we want to research what works and what doesn't work, so that you get to know where to dedicate resources, either as journalists or as fact checkers.
Thanks. And Chris, you know, from the work you've done in the Coronavirus Facts Alliance, do you have any sort of learning so far, talking about the pillars that Lee mentioned about the effectiveness of that work and sort of reaching audiences and even especially reaching beyond the traditional fact-checking audience?
Yeah, the first lesson, Oren, is quite clear. Is competition will only help misinformation. I mean, this is number one lesson that I've learned, and that collaboration is the only way out, if there is one, to fight misinformation. I mean, if the 99 organizations that are now together in the Coronavirus Alliance tried to fact check 8,000 claims by themselves alone, they would never be able to do so. So just working together is the key. And we're talking, and this means that you have to understand that when you bring together 99 organizations, you are much more powerful than when working alone. And you can, you know, you will never be able to have in your newsroom somebody that speaks Mandarin, Thai, Italian, Spanish, you know, all the languages in India and all the languages in Africa. And this is amazing when we actually have, Lee and I, we are connected with another 150 fact checkers in the Slack channel. And if we see a hoax that is, it sounds like maybe Polish and it's actually Finnish. And we just post that video in that Slack channel, and there are a bunch of fact checkers, and in like 10 minutes, 15 minutes, maybe half hour, somebody figures out that, hey, it's not Polish, nor Finnish, it's actually, I don't know, Swedish, you know, and somebody helps figure this out, and the fact check is done, and everybody's publishing the same fact check at the same time. This is quite powerful. And this is how we managed, for example, to kill some heavy spread hoaxes, like, you know, the bat soup. Nobody now hears that the bat soup is responsible for COVID, right? We're not getting that hoaxes anymore. That's killed. That was killed by fact checkers, I believe. And we're not seeing those videos of people fainting on subways and supermarkets. So now collaboration in that sense is really powerful. And I really want to stress that competition will not take journalism any further. We need to understand that. If we do not collaborate, the only winner here is misinformation, period.
That makes sense. And back to that, you mentioned the challenge too of dealing with hoaxes and misinformation in lots of languages. It's a question for both Chris and Lee, is what are fact checkers and news outlets doing to reach more people in more languages and in different types of media?
Well, right now the database is being translated in many languages. As I said, originally it is in English, but now we have spreadsheets, let's say. There is in Portuguese, Spanish, Hindi, and we strongly encourage each organization to translate its own content to its own audiences. And besides that, the Coronavirus Alliance has received some funding from Facebook and WhatsApp. We're talking about beautiful $2 million, thanks, to support some many projects in about 20, I think it's 22 or 23 organizations right now that have projects to reach bigger audiences. So we're talking about videos, we're talking about Instagrams, we're talking about newsletters. There's so many projects that were possible to be developed because the Coronavirus Alliance got together, called the attentions of big tech companies, and big tech companies said, hey, let's put money on these people. And these people had cool projects. So, you know, the money circle was activated, and now there are some new newsletters, new Instagram stories going on, videos, YouTubes, you know, there are some new ways to reach audience. You're muted, Oren.
Oh, sorry about that. Lee, I want to pass that on to you as well. You mentioned the role of radio, and I know working with one of ICFJ's fellows in Nigeria, we've been doing some work with video and reaching out to people in Pidgin and other languages in Nigeria. I'm curious to hear more about your work and sort of reaching more people in more different formats.
Absolutely. I think translations are quite important, as Chris mentioned, because not the whole world, for example, speaks English as a first language. So you need to reach them in their first languages. But again, you need to understand every different country. And for the countries we are in so far, if you're not, for example, on radio, then you're not anywhere. And with many fact checkers publishing mainly online, then you need to look at ways of moving those fact checks into the radio space. So we've been looking at working with community radio stations. For example, in South Africa, we had a partnership where we produced content for radio stations and then translated and did interviews with them. So in the languages prevalent to where these radio stations were. We're looking at the same approach in Kenya because radio is really big in the rural areas. So if you can move fact checks into radio, then into audio versions, then I think obviously you are creating a bigger audience for it. But also it's important to understand, for example, we say a number of countries and we're seeing a lot of communities coming online, but again, there's still a huge digital divide. So you need to still look at ways of reaching people who may not be online. And we've seen interesting initiatives, for example, in Congo, where one fact checker is using SMS to send information, correct information around vaccines, and that obviously has a wider reach than just publishing it online. I also think it helps if you do media literacy campaigns. We've got one on WhatsApp, which, for example, has been done in Swahili, in Kenya, and Pidgin in Nigeria. So we've gotten very good reception to this. You know, you're just teaching people the basics of fact checking and doing it in these nice, nifty ways that you can share on WhatsApp, and people quite like them because then again they're teaching you, but also they're in a medium that is quite widely used. So I think the key is to be innovative. I've always thought, for example, if we could do fact checks around, say, we have traveling theater and they go performing in various regions in the interiors, then I think people can then understand, what is the issue and what they can do to protect themselves from false information.
Interesting you mentioned that. Because I know, before I get there, I know we heard stories from India a couple of years ago about exactly that, traveling theater companies who are going around the countryside, telling people about WhatsApp and how to use it properly. Sorry, Chris, I cut you off.
I was just want a quick comment on what Lee just said. I really want to stress this because reaching audience is something that we cannot teach people. People need to tell us what is the best way in each country. So Congo experience is amazing. They are just, during the COVID, they just put their masks on, Congo Czech, and they went house from house getting people's phone number so they could get a list of SMS and send out SMS because internet there is quite expensive and people will not get the tweet or, any other post on Facebook. So it's SMS. Meanwhile, in Argentina, what they're doing is they have just created they have the fact checkers in Argentina created a deep fake with presidential candidates, and they played it on TV with the support of all TV channels in the country. So it would be very clear to the population what a deep fake looks like. So it was like an ad, a TV ad saying, hey, this is a deep fake. We have done this just to show you what a deep fake looks like. So, these are smart ways to reach different audiences, and media literacy is the way out. So I strongly enforce that.
Actually, I want to
and just let me jump in. There are times I also think maybe we need to cloak like the actors, like disinformation actors, we've tried, doing fact checks in video format, so someone claim something that in a video that goes viral. So we try to, counter that by also doing a video and trying to seed it into the same communities or the same channels that the original video was seeded. But maybe it is something worth exploring, cloaking like actors because they're quite successful at what they do, disinformation actors. So if it means working with influencers, it means working with content creators, to then send information in these ways that people are consuming them, then I think probably it's something worth taking a punt on.
That's great. Actually, this is a chance to put in a plug for ICFJ, because as Lee probably knows, our fellow working with Africa Czech is actually working on an influencer campaign now in Nigeria, trying to use that network as a way of getting information out. But one of the challenges in that, and this is a question for both of you, and a question we received from one of the participants, is the challenge of speed. I mean, if I'm going to lie about something, I don't have to bother checking it before I spread something out. How do you, even if you want to take advantage of video and influencer networks and all these other networks, how do you deal with the challenge of having to get reliable, verified information out, but still get it out quickly?
To be honest, you will not be quickly. You have to deal with it. I mean, to be precise is tough. There are so many examples. You would rather be precise and correct than fast, ever in your life. If you're a good journalist, I would never ever change one thing to the other. So drop the need of being fast and furious.
So what's the impact then on reach and influence, and how do you counter that?
To be truth, I dropped my personal history. I before opening Lupa in Brazil, I was I worked as a assistant editor in the political section in the biggest newspaper in Rio de Janeiro. And I once I got involved with fact checking, I just couldn't go back to writing a regular newspaper. Then you realize that, oh my God, everything is like so superficial. These people are like printing things without fact checking. How can they do so? It's kind of enlightening. You see the light. You say, oh my God, no, you can't. I remember once a governor was under a police force strike, and the guy said that the police force had the best salary in the country, and it took me 3 days to say the guy was lying. The governor was lying, and during 3 days that lie stood up. And I was so happy to be the one saying, no, actually, this governor is not, the police forces in Brazil are by state. And I said, no. Actually, Brazil has 26 states. And I said, actually, the salary in this state is the 22nd. I was so happy. And this was a big headline. This is much better journalism than, just quoting the governor, isn't it?
Mm-hmm. And I'm wondering that whether that's something that fact checkers and journalists could do. Maybe part of the job is just telling people, take a deep breath and wait for more information.
You know what, Oren, I keep saying one thing, and this is really hard for us journalists to understand. We will not compete with Twitter and Facebook. Politicians, celebrities, companies, they are already speaking to our readers or our audiences straight. You don't need the press to say, 2 + 2 = 4, or 2 + 2 = 5. Journalists should be those that hear content, hey, analyze that and bring a better version or a critical reading. This is our new role. We will not compete with Twitter.
Right, so actually maybe to take it back, and I know we talked about this a bit before, but maybe as sort of a concrete example, as a responsible fact checker or journalist, if you're trying to get out first before you have all the information, for example, how would you recommend that journalists and the public deal with, for example, this announcement of the vaccine from Russia? What language should journalists be using, and what language have you used in similar cases to make sure that you're delivering an accurate story, but still indicating that we don't know everything yet? And I'm curious to hear from both of you about that.
Thanks, Oren. I think absolutely we'll never be as quick as these actors, and fact checking is tedious work. So in a way, it takes me back to my earlier point that it's important to build collaborations of people who can speed up your work, scientists, fact checkers, and people in the know. In a way, it will cut the time that you need to get something out quickly. But also, my view is that it's important to understand the context at play, because then again, you can then understand why, say, particular misinformation is phrased in a particular way. If it's about, as we say, the Russia, the Russia vaccine, quote unquote, then you probably might try to understand the geopolitics between, say, Russia and the US. Generally, my experience has been misinformation. For you to understand misinformation, for you to get ahead of it, it's very important to understand the underlying intergroup conflicts. For example, in northern Nigeria, we know religious leaders have a lot of influence on vaccine uptake. In Kenya, the church is a strong player in education and influences who people vote for. In South Africa, race inequalities feed into long-standing global narratives about Black communities being second-class citizens. For many African countries, colonial and by extension, Western attitudes towards local cures are still viewed as being dismissive. So, and we see then as a narrative that vaccines from the West, again, are only reinforcing these long-running inequalities. So if you can understand the context in any region, in any country, then it will give you a sense of who might be spreading it, and then you are able to quickly narrow in or zero in on the actors and cut the time you need to publish something or counter that particular form of misinformation. But absolutely, it takes time. You just need to have the right structure under you.
Actually, Lida, you anticipated my next question, because I wanted to ask about the challenges of reaching out to different communities, either religious communities and others. And I'm curious, do you have examples from your work, also for Chris, about what you've done to sort of deal with either specific religious groups or specific ethnic groups, and how do you craft messages and campaigns around that?
Maybe I can just continue. Part of what we are looking at is building what we're calling a fact-checking squad. Identify people who are quite invested in accurate information, identify community leaders or public leaders or other influential individuals we can work with to help combat disinformation and focus on the ethical importance. For example, if it's around vaccines, focus on the ethical importance of immunization, because these people have quite a lot of influence, and it's important, if you can build a community of people who are quite invested in accurate information.
Yeah, Chris, I'm curious about your response to that too. I expect in Brazil and other parts of Latin America and the rest of the world too, there are all sorts of local communities that might be large numbers of people, but may not be reached by, let's say, traditional media in major languages.
Yeah, Oren, yes. But I'd like to comment the other question first, because I think there is a point that is really important for journalists that we are forgetting. We knew for at least, let's say, 2-3 months that the planet is searching for a vaccine. So we journalists needed to be ready for the day a vaccine popped up. We needed to create a database of information about vaccines. We needed to know, we have a good phone book about, or email address contact list of people who we should call whenever this vaccine is announced. We needed to have data. So this is how fact checkers should work when we know something is about to happen. I'm saying the COVID vaccine, I'm talking about elections, I'm talking about, anything that is predictable. You need to plan your coverage. So this is going to happen. The scientists are working towards a vaccine. So how are you going to cover this when this happens? So this demands planning. You cannot come to this day. Today, Russia announces a vaccine. And you cannot say, oh, what do we do today? No, this is not acceptable from a fact-checking perspective, and not acceptable from a journalistic perspective. You had to plan this a long time before. And you should now have in your newsroom a lot of information regarding what does WHO, for example, expect what is the process for testing a good vaccine? What other vaccines should look like how long does it take? How long do you test in animals? Do you test in pregnant women? Do you test in elderly people? Do you test in kids? What is a time frame? How does it look like? You need to, now it's time for us, reporters and journalists, to hear the news and explain how the process was for every other vaccine that was accepted worldwide. This is the time for explanatory time. Okay, we can't say the vaccine is not going to work. We're not scientists. Probably the science now is diving deeply in whatever Russia is doing. So now it's time for us to look back and say, hey, other vaccines were like this and like that. This is what we should expect for the next week, 2 weeks, month. This is now time to explain the people. And this is something that people and journalists and fact checkers should have been prepared a long time before. So please do not say that we are getting caught as surprise. Oh, surprise. Okay, this is not good as journalists. And then to your point, Oren, of course, I mean, Brazil, we don't have the language problem because it's amazing. We are almost a continent, but we do speak Portuguese mainly, and it's mainly understood everywhere. American Spanish-speaking countries, they have beautiful translations into Quechua in Peru, and what I'm seeing especially is the need of converting fact checks into images, and I'm seeing great, beautiful work being done in Paraguay. There are beautiful illustrators trying to convert a fact check into illustrations, because it's not only the language, I mean, the different language is a problem, but illiteracy. People who doesn't know how to read. And maybe Lee can talk about what's grapple and what's up too, because that's also, I think that also reaches the people that doesn't know how to read well also.
Mm. Yeah, so thanks, Chris. So what's crap on WhatsApp is a voice note show that we produce on WhatsApp. We do it every 2 weeks now. Initially, we were doing it once a month, and we I'll hoping to maybe to ramp it up if we can get more funding. But the idea is to crowdsource misinformation from audiences. So let audiences know that there is this tip line, this hotline that you can send something that you've seen circulating in your WhatsApp networks from mom, from pop, whoever. And then what we do is we index everything that is sent to us, and then we can see what is, what is trending or what are people asking a lot, and then we can focus on those. So we then zero in, say, focus on the 5 most shared pieces of misinformation, and then we do a voice note show. We go and record in an actual radio studio, and then we answer all these questions, give people the right information, and then send it back as a voice note show. And it tends to be quite short, obviously, for you need to consider the attention span of people and data and that kind of thing, but it's been quite well received. So right now we are looking to research if it's making people's, if people are changing their behavior based on being exposed to accurate information in a voice note show. So we've partnered with some academics to research if it's helping people be more aware, or rather share more accurate information.
That's great. When do you expect to get some data back on that?
Probably by the end of the year. We only just designed the quiz that goes into the people we're targeting, and then we obviously built an incentive into that to retain people. Obviously, you need to make it worth their while, and then we will take the lessons at the end of the year.
That's great. And thanks, Chris, for mentioning that. I think that's the best name of a fact-checking initiative ever.
You should see the emoji for it. You can't miss it. Yes.
People will, when they go through the link, everybody will see the emoji, which is absolutely.
Yeah.
So, Chris, are there any similar initiatives like that you're aware of in other regions?
You mean in audio, in voice note shows?
Audio, voice notes, yeah.
There are many podcasts. I see there is a bunch of podcasts, and I like that, because we need to reach that audiences those who are lazy to read, but might be good in, like, while driving or while taking the subway, or even like about to sleep or taking a shower, anytime. I keep saying, Oren, that fact check needs to be like brushing your teeth. You got to do it every day. And, you wake up and, you either check your fact check bot, or you know, play your podcast, and, you know, before you go out on the street, you know what was the latest hoaxes around whatever, COVID, election. So you have your shield for the day. So this is my goal. Like, people need to understand that fact checking is just like brushing your teeth. You got to do it every day.
That's great, thanks. I wonder actually if either of you have questions for the other as well, about your various experiences. I know you work together as well, but I'm curious to hear if you have another questions for each other based on what we talked about.
Haley, I wanted to know if you agree with me that we need to talk to regular people about what they need to do when they criticize the false content, and what would be your advice, like your number one advice for regular people when they see hoax on Twitter or on Facebook? What should they do when they criticize something that is false?
I think our experience is everyone is vulnerable to misinformation. So people rarely know that it is a hoax. So I've always said we may have the fanciest tools in fact checking, but the individual is the best tool there is. And this involves just taking a pause to just interrogate the information you are seeing, because you know, that allows you to think, what am I seeing? Does this trigger me? Because you know, that is always a red flag if it's evoking some emotion in me. So I think my biggest advice is always, as a person, just take that minute, pause, yeah, and try and interrogate what you're seeing, because generally, you know, a lot of misinformation relies on wisdom of the crowd. You know, if it's been forwarded to me, it must be right, and you know, and I think also speaks to us to probably research why some factors are prevalent in misinformation. I always say, for example, we're talking about vaccines. You'd think it's just about getting a jab and moving on, but we've seen vaccines have become a lightning rod for so many other things, and income inequality, educational disparity, racism, gender discrimination. So I think you know, we need to research what is the environment that has created room for misinformation to fester. But in terms of the number one advice, just take a pause. Yeah, there's a campaign I've seen run by the Young African Leaders Initiative. It's a Mandela, run by the Mandela, I think it's related to the Mandela. I can't remember what, I think it's Mandela Institute or something, yeah? But it's in partnership with the US government, and they call it Stop, Verify. Stop, Reflect, Verify. Yeah, so I think those first two steps, stopping and verify and reflecting, are quite important. Else, you know, whatever fancy tools you see for fact checking, they're not gonna be any better than you as a person.
I want to add one thing. After
Yes.
verifying, if you find something is false and you want to comment on that, and this is something that I've been saying in my personal social media accounts, because you know, you all know that Jair Bolsonaro, the Brazilian president, is spreading a lot of misinformation regarding COVID, and it's not helping the death toll in Brazil, and it's not helping the disease at all. And what I'm seeing is a very easy media literacy tip, and I would like to share here, if Oren allows me, is please, if you see false content and if you want to criticize this, do not spread it. If it's a video, do not retweet the video. Make a screenshot and post it as an image. And if it's a photo, make sure that you somehow mark the photo. Like, you know, use your phone to go make an X over the photo, or write something above it, you know, and just to make sure that while commenting and criticizing some falsehood, you are not also giving oxygen to that falsehood, because we do not want bad information to travel even further, because algorithm in social media, they don't understand when you share a false content. they don't understand whether you're criticizing or loving it. So please, when you find something false and you want to criticize or point it out, make sure you are smart.
Yeah, if I had to ask Chris a question, you did ask me to pose something to her. You know, Chris, you've got this almost bird's eye view of misinformation through the Alliance. You know, you get to see the work of fact checkers around the world and what they're doing. And I wonder if there's anything you've picked out, similarities or differences, you know, in what kind of misinformation flows, you know, how it crosses borders. You know, are you seeing particular types of misinformation, say, in the global north as opposed to the global south?
Thank you, Lee, for the question. This is the most beautiful lesson I've learned when dealing with the Coronavirus Facts Alliance. We've seen, I've been writing some weekly reports on the work that you all have been doing since January, and there are at least 8 big waves that went global in terms of falsehoods. And to go over all of them very quickly, first of them, we all saw a lot of hoaxes regarding the origin of the virus. So I said before, the bat soup, Bill Gates is the man behind it all. You know, we all saw that, the entire planet. And then the second wave was a bunch of photos, videos of people, people fainting or manipulated images and content like that. So we were horrified with the virus. Then the virus can kill you right away. The third thing that we saw globally in that comes from the Coronavirus Facts Alliance database is a lot of falsehoods about fake cures and fake preventative measures. So, but then that's an interesting point. We saw a local flavor. While in India, people were sharing that cow urine was good for COVID. In France was cheese. And in Italy, it was garlic. And in Spain, it was wine. And in Argentina, it was tea with lemon. So depending where you are, the false cures had its own flavor. Besides, of course, the vitamin C and, you know, those hydroxychloroquine and stuff. Then the fourth wave, it went global, was the anti-China. Like China was not capable of keeping the virus inside, Then we saw a lot of politicization, how politics were spreading falsehoods or also being used, you know, falsely in the game, and their names were being also used. And then we saw also how, when the planet started to shut down, like, you know, lockdowns in Italy, Spain, and India, and in some other countries. We also saw a bunch of e-commerce phishing issues. This was global too. And then we saw a terrible moment that was racism and religion. That was very bad. We saw like people saying that, you know, black blood wasn't being affected by COVID, which is false, and how Muslims were more protected from COVID. So, you know, we started to see religion and races, you know, being mixed with the COVID issue. And what we're seeing now, as I said, is the vaccine issue. I mean, all the hoaxes regarding vaccines. So these 8 types of hoaxes, they were spread globally. And this means there are no barriers at all for falsehoods. That's sad to know.
Unfortunately, it's sad to end on a list of hoaxes, but if everybody goes to the Coronavirus Facts Alliance, we'll find out that none of those are true, and that'd be useful information. I think we're coming to the end of the hour. I'm back to Stella to see if we have any other questions before we wrap up. I think not. So any other, I think we have like maybe 30 seconds if you have any other quick comments. I think the pause to reflect is a great way to, maybe as a parting piece of advice to everybody. I want to thank you again, Chris. Thanks, Lee, again for your time, and thanks for your excellent advice. And I hope everybody goes out and checks out both of their projects. and signs up for What's Crap on WhatsApp and goes to the Coronavirus Facts Alliance and checks out the bot. And come visit us at the International Center for Journalists. So I think we'll close it there. Thanks again, everybody. And we hope to see you soon in another webinar.
Thank you, Oren. Thank you, Lee. It was great to see you guys.
Thank you. Thank you, Chris. Always a pleasure. Thanks, Oren, Stella, everyone.
Bye, Stella.